Well, I found working at a major teaching institution that has a world-renowned cancer center that I was getting a lot of questions, not only from my colleagues in oncology, but also from my patients in pain management about the use of cannabis in lots of different scenarios for pain, for cancer management, such. And I found that there was a lack of willingness to discuss or even knowledge about the topic, and so decided that I would take the golden ring and go forward and educate my peers to the best of my ability and continue to educate myself about the utility of cannabis medicinally.
I was familiar with cannabis in college, and even at that point I was aware that some women were using cannabis medicinally to treat menstrual cramps. But it was then, about 10 years later, in 1980, I first encountered what I called a medical cannabis patient. And this was a veteran at the VA hospital who mixed cannabis into his pipe tobacco and had cut down his hospitalizations with myasthenia gravis very markedly through this use. Subsequently, when I was a neurologist in practice, even in the 80s and 90s, probably a third of my multiple sclerosis patients were using cannabis medicinally. About 1996, I became embroiled in the cannabis controversy about the same time that California developed its medical cannabis law and other states followed. And at that point, I was interested in studying cannabis as a treatment for migraine, but was unable to do so in the federal structure of things. In a sort of adolescent rebellion, it made me want to do it more, and eventually it became a second career.
One of the papers that I discovered in doing all of my lit reviews and all of my self-education on the use of cannabis was a paper that Dr. Russo had written, I think back in 2004, about the endocannabinoid deficiency syndrome, that spoke to me in such a meaningful way that it really propelled, again, not only my need to discover more, but it spoke to a rationale where cannabis could be used in disease processes such as migraine or fibromyalgia or irritable bowel or interstitial cystitis, a lot of the patients that I was seeing in the chronic pain clinic.